Welcome to the Bureau of Family Health's Care Coordination in a Pediatric Medical Home Introduction. This short learning is designed for busy providers committed to improving the health and well-being of families across Louisiana. This video will focus on 3 points. What is care coordination? Why is it important? And where to access resources to make care coordination easier. Pediatric Medical Home and Care Coordination. Care coordination is central to the pediatric medical home, the gold standard of pediatric care, as described by the American Academy of Pediatrics, or AAP. The medical home healthcare delivery model uses a team-based approach that brings physicians, nurses, allied health, and families together to provide comprehensive care that addresses the interrelated medical, behavioral, and social needs that influence a child's health. What is care coordination? Care coordination is defined by the American Academy of Pediatrics as patient and family-centered, assessment-driven, team-based activities designed to meet the needs of children and youth while enhancing the caregiving capabilities of families. In practice, this means aligning the care team and supporting families to manage ongoing care so that no child's needs are missed. Care coordination fundamental elements. Care coordination uses a family-centered approach, with families serving as active members of the care team and key decision makers. Effective coordination requires collaboration within the clinic team and across disciplines to assess and anticipate needs, monitor progress, and adjust the plan of care as needed. Other fundamental elements of care coordination include clear, consistent communication among the care team, families, and external providers. This requires defined processes and staff roles for managing referrals, documentation, report sharing, and follow-up. Timely care plan updates are essential to ensure the entire team, including the family, remain informed and aligned. When done well, care coordination is proactive and anticipatory, aiming to prevent crises rather than reacting to them. Now that we've described what care coordination is, let's talk about why care coordination is essential to improving health outcomes for Louisiana's children. Louisiana's pediatric population experience some of the highest health risks in the nation. Over 30% of children aged 0 to 17 meet criteria for a special healthcare need. Children and youth who have special healthcare needs either have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions. They require services beyond what other children require. 30% of children aged 3 to 17 experience a mental, behavioral, developmental, or emotional problem. And nationally, Louisiana ranks second for childhood poverty, with 27% of children living below the federal poverty level. So why care coordination? Poverty and related social factors such as food insecurity, unstable housing, transportation barriers, limited internet access, and language differences significantly impact children's health and development. Children experiencing medical or social complexity needs require services and supports from various providers and systems of care. Even in the absence of chronic health conditions, social complexity can create high levels of need for children and families. Why care coordination in the medical home? The rationale for care coordination is well established in scientific literature. Research demonstrates that effective care coordination can prevent duplication of services, reduce delays in care, avert preventable hospital encounters, facilitate smooth transitions across care settings, and connect families to essential medical, behavioral, and community resources. At its core, care coordination ensures that the right support reaches the right child and family at the right time. By emphasizing prevention and early intervention, it contributes to improved health outcomes and a more efficient system of care. To help put care coordination into action, the Bureau of Family Health has developed a Care Coordination Toolkit. The Care Coordination Toolkit is a virtual one-stop shop for quality improvement worksheets, care coordination resources, and pediatric referral guides. The toolkit uses a stepwise framework to break projects into doable action items. Additionally, no-cost expert technical assistance is available to practices through the Title V Pediatric Primary Care Training and Support Center and are supported by Title V funding. The Care Coordination Toolkit makes it easy to assess, plan, and test. Use the Bureau of Family Health Care Coordination Toolkit to build the capacity of your clinic staff through quality improvement. We hope you take a few minutes to explore the Bureau's Care Coordination Toolkit to see how these resources can support your clinic's care coordination goals. For questions or support, email the Bureau's medical home team at familyhealth@la.gov. Thanks for joining us today. The Bureau appreciates your efforts to improve the health of Louisiana's children. Check out our provider medical home toolkits through the QR code on the screen, including Developmental Screening Toolkit, Care Coordination Toolkit, and Youth Health Transition Toolkit.